Dumoboros. That sounds like a magic card. Like a magic card for like April Fools. Very funny. I should link that we're live. I should do that. That. Or, okay. Alright, just gonna grab my tea and then we'll get started. Hello, welcome back. It's like you never left. You wanna know why it's like you never left? I've been wearing the same clothes for like 3 days. Because I am exhausted. And I am rolling out of bed, I am doing streams, and then I'm rolling back into bed. Oh, man. Okay. Hello, welcome, hi. Hello, hi, hi. Hey, if you guys put in Canadian flag emojis, will they all fly around the screen? Like, does the Canadian flag emoji go? Because I know sometimes some emojis they just don't like to take. So if you guys could do me a solid and throw a bunch of Canadian flags in the chat just to see if it functions. I'm pretty sure it functions. I just want to see a bunch of Canadian flags flying everywhere. Oh, man. I thought of some stuff about yesterday. Specifically about, like, this show from yesterday. When we were talking about, euthanasia, and the argument being like, well, if there's a mistake, we'll... Yeah! Yeah! That's wonderful. It works. Thank you for checking. Greatly appreciated. Okay. So, the argument was, like, there could be the same as the argument for the death penalty, which I think is a bad comparison, but the argument was, yeah, I changed the debate hub time. Yeah, that was my bad. I put 5 instead of 5 a.m. instead of 5 p.m. That's my bad. I'll also update like thumbnail and information because I didn't have... Craig told me, but I didn't have a lot of the information because, I mean, probably he didn't know, but I was missing information and then I fucking fell asleep. So, that's all updated and should be good to go over there now. Okay, so the argument yesterday was if there is a mistake and somebody who gets MAID ends up dying due to a mistake, which doesn't really make sense with the way MAID is set up in what they're presenting, but it's okay. We'll take it as it is for now. If MAID successfully, out of 22,000 people that applied for MAID, if 16,000 were rejected and nearly 700 decided to withdraw their application, presumably because they found help through other means or they were rejected and were sent to other places to go get help, does that mean that MAID saved that number of people? So let's put it on the low end and let's say it's 600. Because that's like leaves a room for error, that leaves room in that 16,000. Presumably at least one of these people has gone and gotten other help through other means and chose to not go through with unalivened. So which at that point you have a question to say which is the priority. If not having access to MAID at all and debunking the program or defuncting the program means that of those 22,000 people that did go through with it, all, like, the fucking, 90% over the age of 75 with terminal cancer, and you made those people suffer for another decade, let's say another 10 years, and of the people whose lives didn't go through MAID and they were rejected and got help or changed their minds and withdrew their applications, of those 600 people, whose life is more important? The one mistake in a malformed argument, or the 600 people whose lives ended up getting help? Kind of confusing, isn't it? And the reason why the comparison, or why the juxtaposition doesn't really work quite so well is because the argument is so malformed, right? Because the position is malformed in the first place. And so because the position is malformed in the first place, because like you can't compare, like MAID cannot make that kind of mistake because it is voluntary. So by its nature, that is not like when you say a mistake, you can't, you could never possibly know. Even if there is an afterlife and somebody unalives themselves through MAID, and then in the afterlife, they're like, ah, shit, I shouldn't have done that. We could never know. You gonna do tarot readings or some shit? Oh, man. Anyway, I was just curious about what your thoughts on that were. Like, what is one person's life more important than another person's life? Or is like the number of lives? If you could save one life versus saving 600. Which I guess is like a little bit of utilitarian, assuming that like life is worth more. DA2. Death isn't a choice, it's the only choice. It is the only option. I gotta make sure I did my shit right. Yeah, happy Saturday, by the way. It looks like I did do my shit right, okay. Okay. The ones arguing MAID are not good are ones that didn't pay attention or offer any help until the attempt was made. Yeah. Yeah. Or until the attempt was successful. Surprise! It's me! Okay, I'm just gonna stall a little bit and wait. Like, I figured I'd talk about that a little bit at the beginning because, like... Hey, Jumbo's back. Welcome. Should MAID be focused on highly suicidal people since they seem to live in huge misery already? I don't think MAID should necessarily be focused. I think that, like, what makes somebody applicable needs to be strict and thorough. But I certainly don't think people who are depressed or have mental health issues should be treated any less than somebody with a physical ailment. So, for example, I don't think depression should be treated less seriously than chronic pain. If that makes sense. That makes sense? I don't know why I'm saying if that makes sense. That makes sense. I know it makes sense. You know it makes sense. Everybody should get it. Of course, I'm just saying, like, you will show commercials and have demographics. Wouldn't this also be true for somebody who wants to die through? You would show commercials and have demographics. I mean, the data should be there if that's what you mean. And MAID isn't something that gets advertised on TV. At least not that I'm aware of. From my understanding, MAID is like, it exists, but it's not like offered loosely. It's like a very specific medical track that you put yourself on, either track 1 or track 2, and that can be recommended to you by a professional. It's not something that would show up on TV. It's not something that gets advertised. It's like you're seeking help due to your issues, and a medical professional like a doctor or a psychologist can make you aware that the program exists. Gonna get me a maid outfit. I mean, I know MAID is also like an uncomfortable conversation for a lot of people, and that's fine. But if you're being uncomfortable is not a valid reason to deny somebody their rights as a person, right? If you had a group of people that once they are shown MAID or made aware of MAID, have a high chance of using the service compared to other groups, would you then try to show this demographic MAID more frequently, or like just try hard to make them aware of it? Good question. I don't think so. The demographic, so like if we look at the data from 2023 and 2024, right, which we have easy access to, and MAID had been in place since like 2016, so there's like a handful of years of it building up, and you look at the data shows that the users of MAID, the demographic is like 90% above the age of like 70 or 75 with terminal cancer. So like I guess that information might persuade doctors to bring MAID up more easily to somebody who has terminal cancer and is in the older end of their lives. So, but I don't know how hard you would need to like try. Like you're a professional and you're already in that position. Like I'm not gonna be out in the street telling people that MAID exists. You know what I mean? Well, I guess I'm kinda doing that now, but you know what I mean. 90% of people using MAID are that old, but that might be just because there's a lot of old people. There is the like the boomer bubble, right, where there's the population is like staunchly the size of the population at this age. That is a factor, yes. That is in the data, and that would be considered. But I mean, it's not. I think what you're getting at is whether or not you would expand the program and make it more approachable for a larger demographic. But I don't know. And the reason I'm going to say I don't know is because I am not a professional in that case. So because I'm not a mental health care worker and I am not a doctor, I don't know if the program would need to be expanded. It was expanded from track 1 to track 2 to include more things rather than, because it was originally just terminal patients. Like, you're going to die. It has to be like reasonably foreseeable, a reasonably foreseeable death that you would give given access to this. And then they expanded upon that to add track 2 to say like people living with chronic illness and chronic like either physical or mental illness that have get approval. They apply and then they have to get approval from 2 separate doctors, et cetera, et cetera. So that they expanded the criteria. So should the criteria be expanded more? I don't know. I suspect that people are less likely to offer or sort of bring MAID up as an option, or are more, I should say, are more likely to just make the option of like say that this option exists, but then dissuade people from using it based on their age. So I suspect somebody who's like 17, who does not have terminal cancer, and is made aware that MAID exists because, you know, they have the internet or something, they looked it up. And they go to their healthcare professional and they say, hey, I'm interested in this program, I want to apply. And the doctor will say, well, you could do that, or here are the other options, here are the things that are available to you, da 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 da. Whereas opposed to if they're like 75, maybe they spend a little bit less time doing that. But I don't think you would expand the demographic that MAID is available for is specifically through professionals. It's not through like people's opinions, right? So yeah, I think if there was going to be any expansion, it needs to be done by people that are professional in the field. Whether or not it's like, I think if you have a demographic that has an extremely high suicide rate, then you need to figure out who that demographic is and see if there's any solutions to ease whatever is causing that. and be like, okay, well, why? Which demographic are you talking about, since you got one in mind? Isn't the logic of MAID to end someone's suffering, meaning the suffering is personal and not an external person can diagnose? Not quite. That's part of it. So, like, MAID is voluntary. And MAID is... The diagnoses isn't to diagnose pain. Chronic pain can be diagnosed. How bad the pain is self reporting. Right? It has to be. But you can still get a diagnosis. So yeah, there isn't a scale of you have to go through X amount of pain because we don't have a measuring system for that. Suffering can be mental. Yeah, of course. Like depression can be diagnosed, for example. Yeah, mental health applies for sure. The first time I heard of MAID was from someone reacting to Tucker Carlson saying how evil we were for killing our people and worse things than that. Ah, yes. Leave the poor injured bunny to suffer and starve to death over the next couple of days instead of just ending its life. I was feeling down the other day, so I called MAID. They said the first one's free. That's funny. So technically, if we had a young person, let's say 18 years old, okay, and they say they are experience a lot of mental health suffering, yeah, because of reasons, would this person be eligible to use MAID service? They would be eligible to apply. So you have to... It's not a... It's not like a program that you just call and they just go, oh yeah, okay. You go to... you have to get approval from 2 separate doctors. And, well, yeah, technically anybody can apply. Technically, yes. But you need... They would be rejected. Yes, likely they would be rejected. It depends on like their medical history, and then it also depends on the professionals that they've spoken to. You have to get two separate professionals, so they can't be like doctors in the same clinic or whatever. You have to get like one from here and one from here, and then they both have to agree. They have to give the diagnosis. They have to agree that MAID is an appropriate option, and then you are offered, like, they walk you through the program, and the program will like be like, okay, so have you tried this? Have you tried this? Have you tried this? Have you tried this? Yes, no, yes, no, yes, no, yes, no. Right? And so if there are other options, those other options during the process of obtaining MAID will be offered and made available to you. So if an 18-year-old says they're experiencing a lot of mental suffering because reasons, their professionals are going to go through and be like, okay, well, what are those reasons, and are those reasons something we can mitigate? Yes, no. I had the trans community in mind. Oh, well, did you? Color me a little bit unsurprised. They have the highest suicide rate, at least to my knowledge, so I wonder if these people would want to use MAID. What do you think would happen? Do I think that there is, like, if we were to look at the statistics of MAID as it is right now, which does include mental health, you're asking if the demographic that is not that, like that 4.4% or whatever it is, that is not the 75-year-old terminal cancer patient, right? Of that 4.4%, is the demographic overrepresented by LGBTQ plus people, or trans people specifically within the LGBTQ group? Yeah, if your sole underlying medical condition is mental illness, you are not eligible to apply for MAID until March 17th, 2027. Yeah, it hasn't been. There are some things that haven't been expanded on yet. And we're saying suicide. Yeah, I give up. Fuck it. Fuck YouTube. Suicide. People committing suicide. No, I'm asking what if you think they would be allowed to proceed using MAID once they apply. If they match the criteria, right? If they match the criteria for MAID when they apply, whoever they are and whatever they have, as long as they match the criteria, they would go through the program. The criteria being determined by the two experts. No, well, the two experts is part of the criteria. You have to get two experts as part of the process. You have to get two separate experts or professionals. That's not the only criteria. Right? The MAID has its own criteria that the professionals are using. Right? The criteria meaning, like, for example, like what Jason said. Right? Not eligible until March 2027. Do you want me to pull up the... You just want me to pull up what the MAID in Canada... Dawn actually makes a good point too. The suicide rate for trans people is not that high. Commonly cited as a 41% figure is attempts. The full deal around 75% per 10,000 average of a rate of 21 per 10,000 people. Do you have a citation for that? Like, I think you're probably right. I'm just curious if you have like an easy reference that I can pull up. Criteria. Let's pull up the criteria for MAID. Like, if you're concerned that MAID is going to disproportionately affect LGBTQ plus people, I think that might be a little bit... it's a reasonable concern, but I think it might be unfounded. Okay. So here's the criteria. Oh, spanks! Thank you for the citation. Is this in the United States? Transgender identity, suicide attempts, mortality, oh, it's Denmark. Okay, interesting. Important prior study suggested that transgender individuals may have may be a high-risk group with respect to its suicide attempts and mortality, but large-scale population-based investigations are lacking. Objective to examine the national setting of whether transgender individuals have a higher rate of suicide attempts and mortality than non-transgender individuals. The design participants are nationwide register-based retrospective cohort study on all 6,657,456 Danish-born individuals aged 15 or older who lived in Denmark between January 1st, 1980 and December 31st, 2021. Transgender identity was determined through national hospital records and administrative records. Main outcome and measures: suicide attempts, deaths, suicide deaths, non-suicide deaths, and deaths by any cause during 1980 through 2021 were identified in national hospitalization and causes of death registered. Adjusted incident rates ratios with 95% CIs controlling for calendar period, sex assigned at birth, and age were calculated. The results: the 6,657,456 study participants, 50% assigned male sex at birth, were followed up during 171,023,873 person years. Overall, 3,759 individuals, or 0.06%, 52.5% assigned male at birth, were identified as transgender at a median age of 22 years old. IQR 18 to 31 years, and followed up during 21,404 person years, which during which 92 suicide attempts, 12 suicides, and 245 suicide unrelated deaths occurred. Standardized suicide attempt rates per 100,000 person years were 498 for transgendered versus 71 for non-transgendered individuals at a 7.7%. Standardized suicide mortality rates per 100,000 person year were 75 for transgender versus 21 for non-gender individuals at 3.5%. Standardized suicide unrelated mortality rates per 100,000 per year were 2,380 for transgender versus 1,310 for non-transgendered individuals at 1.9, and standardized all-cause mortality rates per 100,000 persons per year were 2,559 for transgendered versus 1,331 for non-transgender individuals at a 2.0. Despite declining rates of suicide attempts and mortality during the 42 years covered, AIRRs remain significantly elevated in recent calendar periods up until and including 2021 for suicide attempts at 6.6, suicide mortality at 2.8, suicide unrelated mortality at 7.1, and all causes of mortality 1.7. Conclusions and relevance. In this Danish population-based retrospective cohort study, results suggest that transgender individuals had significantly higher rates of suicide attempts, suicide mortality, suicide unrelated mortality, and all-cause mortality compared with non-gender population. Conflict of interest disclosures. Dr. Erlangsen reported receiving grants from Danish Health Foundation during the conduct of the study. No other disclosures were reported. Fascinating. Yes, Denmark. Very, very interesting. I'm going to share this over on the YouTube stream as well. So there's more factors to suicide than just mental health, obviously. Well, I mean, I guess I'm being like, I'm not really saying that very well, am I? What do I mean to say? How do I say what I mean to say? I mean to say that there's more factors to mental health than just your brain. So like your environment, the people around you, how society treats you, etc., right? There's a Dutch documentary about a 17-year-old girl who died with the help of euthanasia after suffering from psychological problems. 3 years later, it's still causing new controversies. Interesting. Has the NDPG tried on the argument that MAID is actually Canada's answer to transgender exclusion? I'm not sure the disability one is landing. No, I don't think so. I don't think they've tried that one yet. I'm a little bit disappointed in the NDP if this is the direction they're going in. Anyway, here's the MAID. So back to what Jumbo was saying. Here's the some of the requirements, right? The criteria, right? So medical assistance in dying, or MAID, is a process that allows someone who is found eligible to be able to receive assistance from a medical practitioner in ending their life. The Federal Criminal Code of Canada permits this to take place only under very specific circumstances and rules. Anyone requesting this service must meet specific eligibility criteria to receive medical assistance in dying. Any medical practitioner who administers unassisted death to someone must satisfy certain safeguards first. Only medical practitioners are permitted to conduct assessments and to provide medical assistance in dying. This can be a physician or a nurse practitioner where provinces and territories allow. There's the legislation. So if you want to see like the legislation, the laws and stuff like that, the former Bill C7. But let's keep going in here for now. There are two methods of medical assistance in dying available of Canada. Method 1 is a physician or nurse practitioner directly administers a substance that causes death, such as an injection of a drug. This is sometimes called a clinician-administered medical assistance in dying. And method 2, a physician or a nurse practitioner provides or prescribes a drug that the eligible person takes themselves in order to bring about their own death. This is sometimes called self-administered medical assistance in dying. Clinical guidelines and practices outline which drugs, drug use, and are established by provinces and territories and organizations that regulate the practice of medicine. So that would be like the Board of Ethics and many of the drugs commonly used for this procedure are already available in Canada. Healthcare providers usually provide them at lower dosage for common purposes such as nausea, pain control, and anesthesia. As the regulator of drug products, Canada Health is working with partners to help support access to the drugs for medical assistance in dying. Eligibility. To be eligible for medical assistance in dying, you must meet all the following criteria. All of it. All of it. So no half this, no part that. You must meet all of it. Be eligible. You must be eligible for health services funded by a province or territory or the federal government. So people from the United States can't, like, hop the border to come and get suicide medication, all right? Not a thing. You may also be eligible if you meet your province or territory's minimum period of residence or waiting period. So you might be able to apply if you came from abroad and then decided to do that here, but you have to meet the province's requirements for whatever that is. Must be at least 18 years old and mentally competent. So when I gave the example of a 17-year-old earlier, that wouldn't apply. You have to be 18 at minimum to be able to apply. And you have to be mentally competent. So if you are deemed not mentally competent, you would not be able to apply for MAID. So if you are somebody who cannot, you are considered somebody who does not have the mental stability, or does not have so somebody who's got what's the name of it? Oh, what's the name of it? There's a shit. You guys know what I'm talking about. Somebody doesn't have they're not mentally 18 years old, right? They're not mentally over the age of 18. So you would not be able to apply for it. Have a grievous and irremediable medical condition. So you have something that it can't go away, can't be cured. You can't fix this. Make a voluntary request for medical assistance in dying. So you have to make a voluntary request. Something nobody can coerce you. Nobody can just sort of drive you towards that track. Nobody can do it for you. You have to be able to voluntarily do this yourself. Your mom can't do it for you, or a guardian can't do it for you. If you're somebody who needs to have a guardian, you likely do not meet the criteria. The request cannot be the result of outside pressure or influence. Give informed consent to receive medical assistance in dying. Informed consent. So you have to know what you're doing, you have to know what you're signing up for, you have to have all of the da-da-da-da-da-da. Alright? Generally, visitors to Canada are not eligible for medical assistance in dying. Grievous and irremediable medical conditions. There's no reason why a trans person should not be able to apply to this if they wanted to, and then be able to meet the criteria, again, provided they have a grievous and irremediable medical condition, and they're above the age of 18. Right? So there's no reason why anybody from the LGBTQ plus community would be excluded from this, right? Why would you? Why would you exclude somebody like that? That doesn't make any sense. Grievous and... One second. Alright, I have returned. Well, yeah, hyperbole, Dawn is right. Hyperbole would not be, rhetoric and hyperbole are not medical conditions, right? Rhetoric and hyperbole does not inform someone's medical condition. That's why you need a practitioner or a professional to do a diagnosis and an assessment, right? There are some again, this is also Canada specifically. So there are some things that are available for the trans communities in Canada that aren't available in other countries when it comes to access to medical care for transitioning. Where some things are considered voluntary and some things are not. And some things are really expensive and some things are not. And some things you can get subsidies for and some things you can't. Right? So that's about balancing. Now, is there an argument to be made that more things should be made accessible to more people easier and you want to expand those programs? Sure. You can make that argument. So if you want trans people to have easier access to medical care. Yeah, we're continuing yesterday's topic a little bit. Because we had a couple questions about what exactly the criteria for MAID was. So we're going through the criteria. Okay. So grievous and irremediable medical condition. All right. So let's talk about what does that mean, right? To be considered as having a grievous and irremediable medical condition, you must meet all of the following criteria. Have a serious illness, disease, or disability. Be in an advanced state of decline that cannot be reversed. Experience unbearable physical or mental suffering from your illness, disease, disability, or state of decline that cannot be relieved under conditions that you consider acceptable. Also, against the common sense of Western people, cosmetic surgery is actually one of the most reliable ways to increase happiness long term. So I think framing it more like this would substantially increase my quality of life is more accurate. Yeah, I think you're correct about that. There is like in like the United States and Canada, there's like a shy away from cosmetic surgery, but it's not like that everywhere in the world. So like, get good. Like, it's not a big deal. It's not. I don't think it's a problem if people want to get cosmetic surgery, get cosmetic surgery. And if cosmetic surgery is like is going to be taken seriously as a quality of life thing, maybe cosmetic surgery needs to be a little bit more accessible. But because right now the argument, from my understanding, again, maybe I'm a little bit behind on this, but from my understanding, the argument against cosmetic surgery is that it's voluntary and it's not medically required. So we just might need to have a little bit more nuance to that situation. Okay, good luck. They're going off to go do that thing. Or to do some things. They're not saying that this is a cosmetic thing at all. They keep insisting it's life-saving. Well, it's, something that is cosmetic can be life-saving, but again, you're talking about the difference between rhetoric and like what the medical community or like what the standards are going to be in medicine, right? Which are just going to be different things. Because with MAID, it seems like a lot of trans people would use the MAID service. I mean, you can look at the statistics if you want. You can see, like, if you want to look outside of the 95% or whatever the percentage was that we looked at, right? House to yourself, invited someone for anybody. Yeah, I've got the whole house to myself. I'm to clean. My aunt by choice got her gender affirming surgery. She's super happy with it. It really improved her mental health. Yeah, good. Western medicine has a model of health that is very reactive. You're left to your own devices until something breaks. Yeah, that's a good point. Yeah, I mean, particularly in the United States. It's not a per capita number. What? It's it's of the 20, it's the total number. It's of the total number. It's of the total number of applicants that got MAID. So of the total number of applicants that got MAID that were then removed, and then after you removed the number that were rejected. I'll show you the numbers in a minute. Let's finish this first. So you need to have these things. These things are required, right? Then you do not need to have a fatal or terminal condition to be eligible. If your only medical condition is a mental illness, you are not eligible for medical assistance in dying until March 17th, 2027. If you have a mental illness along with other medical conditions, you may be eligible. Eligibility is always assessed on an individual basis and takes all relevant circumstances into account. However, you must meet all criteria to be eligible. Informed consent is when you give permission to receive medical assistance in dying after you receive all of the information you need to make your decision. This includes your medical diagnosis, available forms of treatment, available options to relieve suffering, including palliative care. So this is why, like, the quote-unquote hypothetical mistake that we were talking about yesterday is not possible. You have to, it's voluntary, and you have to be made aware of all of these things. And there is an entire process where you get other forms of treatment made available to you. They find different tracks and different options for you. And you have to have done these things, because as you look at up here, you have to have a condition that cannot be fixed. It has to be grievous. And it can't, where's the other one? It can't be relieved under, that you consider acceptable. Right? You must be able to give informed consent both at the time of your request and immediately before receiving medical assistance in dying, unless special circumstances apply. So, like, you're unconscious or just, like, whatever the fuck they end up doing. You can withdraw your consent at any time and in any way. I'm kind of curious what the special circumstances are. But, regardless. So, you can pull out whenever you want. There's no consequences. And you have to consent 2 different times. And one of them is right before you get, like, your lethal injection, let's call it. Making a request. Regardless of your location, you can request medical assistance in dying if you are eligible. If you're experiencing a lot of pain and suffering due to your medical situation, talk to your physician or nurse practitioner. You can discuss options related to your circumstances and your possible interest in medical assistance in dying. How and where the service will be offered is determined by medical institutions, provinces and territories, and the organizations that regulate health professionals. You may have to meet other requirements. Your healthcare provider can tell you more. If you don't have a regular practitioner, your province or territory may have a central coordination service that can help you support and resources. The roles of province of blah, 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 blah. Procedural safeguards, right? Before a medical practitioner administers medical assistance in dying, they must satisfy certain safeguards. These include making sure that you, 1, have 2 independent medical assessments, 2, make a written request signed by an independent witness, 3, know that you can withdraw your request at any time. 4, provide final consent before receiving medical assistance in dying. 5, give advance consent if acceptable. Sorry, if applicable. They must also meet extra safeguards in the event that your death is not naturally foreseeable. Medical assessments. When you make your request for medical assistance in dying, 2 independent medical practitioners, physicians or nurse practitioners, must assess it. Your medical practitioner must make sure that you meet all of the listed eligibility criteria. The second practitioner must also provide a written opinion confirming that you are eligible. The medical practitioner providing the original assessment and the one giving the second opinion must be independent. This means they cannot knowingly benefit from your death, hold a position of authority over you, be connected to the other or to you in any way that would affect their objectivity. Making a written request. You must sign a written request that says you want to have a medically assisted death that must include your signature confirming your request for medical assistance in dying. If you can't write, another adult can sign the request on your behalf under your clear direction. The adult must be at least 18 years of age, understand what it means to request medical assistance in dying, not benefit from your death. For example, they must not be an heir to your estate. 2. Written request must be signed and dated before one independent witness, who must also sign and date the request. Some provinces and territories may have specific request form for you to complete. You can get this form from your healthcare provided for your provincial or territorial government website. Independent witness. The role of the independent witness is to confirm 1. The signing and dating of the request by the person requesting medical assistance in dying, that the person requesting medical assistance in dying understands what they are signing. An independent witness must be 18 years of age, can be a paid professional or healthcare worker, must understand what it means to request medical assistance in dying. To be considered independent, independent means that the witness cannot benefit from your death, be an unpaid caregiver, be an owner or operator of healthcare facility where you live or are receiving care. Withdrawing your request. You must be informed of your right to withdraw your request for medical assistance in dying at any time in any manner. You do not have to proceed even if you're found eligible for this service. Final consent. Immediately before receiving medical assistance in dying, you must be given the opportunity to withdraw your consent, affirm your consent if you do not wish to withdraw it. An exception to this requirement is possible if you have a waiver of final consent. You can waive the requirement to provide consent just before you receive medical assistance in dying, only if your natural death is reasonably foreseeable and, while you had decision-making capacity, you were assessed and approved to receive medical assistance in dying. Your practitioner advised that you are at risk of losing capacity to provide final consent. You made a written arrangement with your practitioner to provide consent in advance on your chosen date if you no longer have the capacity to consent on that date. Any arrangement of the waiver of final consent will be considered invalid if, at the time that you were to receive medical assistance or dying, you no longer have capacity and demonstrate refusal or resistance to the administration of MAID by words, sounds, or gestures. Reflexes and other types of involuntary movements do not constitute refusal or resistance. Examples of involuntary movements include responses to touch or the insertion of a needle. Advance consent in cases of self-administered medical assistance in dying. You can make a written arrangement with your practitioner so that they can administer medical assistance in dying in the event of a failed self-administration. This arrangement allows for clinician-administered medical assistance in dying if there are complications during self-administration that cause your loss of decision-making capacity but not your death. This means that your medical practitioner must be present at the time that you are self-administering the medications. Requests, hey, Jumbo, when you get a chance, swing back in. If you think these things are weak safeguards, I'd like to know your reasoning why, and I'd like to know what you'd be interested in adding, if you get a hot minute. I'd be curious to know your thoughts. Request where your natural death is not reasonably foreseeable. If the medical practitioner assessing your request for MAID determined that your death was not reasonably foreseeable, there are extra safeguards that must be met before medical assistance in dying can be provided. 1. One of the 2 medical practitioners who provides an assessment must have expertise in the medical condition that is causing your unbearable suffering. If neither of them have this expertise, they must consult another practitioner with expertise in the medical condition during the assessment process. 2. You must be informed of available means to relieve your suffering and offered consultations with professionals who provide services, including, where appropriate, palliative care, community services, counseling, mental health and disability support services. 3. You and your practitioners must have discussed reasonable and available means to relieve your suffering, and all agree that you have seriously considered those means. 4. Your eligibility assessment must take a minimum of 90 days unless the assessment has been completed sooner and you are at immediate risk of losing your capacity to consent. 5. Immediately before you receive medical assistance in dying, the practitioner must give you an opportunity to withdraw your consent, ensure that you give express consent to receive medical assistance in dying. We're almost done. And then we'll discuss more. PNC brings up a good point. Medical practitioners, those who can conduct assessment and provide medical assistance in dying, are physicians, nurse practitioners in provinces where this is allowed. Those who can help provide medical assistance in dying includes pharmacists, pharmacy technicians and assistants, family members or other people that you ask to help, healthcare providers who help physicians or nurse practitioners. These people can assist in the process without being charged under criminal law. However, physicians, nurses, practitioners, and other people who are directly involved must follow the rules set out of the criminal code, applicable provincial and territorial health-related laws, rules, and policies. Providers' rights. Not all healthcare providers are comfortable with medical assistance in dying. Federal legislation does not force anyone to provide or help to provide medical assistance in dying. Provincial and territory governments are responsible for determining how and where to provide healthcare services. They may also make policies around where medical assistance in dying can take place. However, they cannot permit actions that are prohibited under the criminal code. Supporting access. We understand that these providers' rights could create challenges if you want to access medical assistance in dying. Contact your healthcare provider for questions about access. You can also contact your province or territory for information on the procedure and other care options. If you're a healthcare provider, contact your provincial or territorial professional regulatory body for information about your reporting obligations, specific practice guidelines, and learn more at the related links. All right. So, first off, let's talk about what PNC said. PNC says, why bother? They aren't interested in the actual law. They're just inserting their own hyperventilating suppositions. Yes, but sometimes I think that there's value in addressing those things. Not because I really care about them and the individual and changing their opinion, but I find that people who engage in this kind of rhetoric will never learn anything if you don't walk through it with crayons. And even if Jumbo specifically doesn't learn anything, this video can be utilized later. Pointer said something that I think is a little bit funny. It says, but have you considered it may not be 100% safe? You're dying? So what do you mean? I'm not sure what you mean. I also don't know of anything that is 100% safe. So I'm not sure. I'm not entirely sure if you're joking. Very funny joke if you are. If you're not joking, I need a little bit more of elaboration. Is dying considered safe? I mean, being dead seems like a pretty safe thing to be. Like, nothing's gonna happen to you anymore. You know what I mean? I mean, I guess unless you think I guess unless you think you're going to hell or whatever, and then you're suffering forever, but I mean, we would never know about it. It's also safe as I lay motionless in my underground. Yeah, me and PNC are on the same line. The guy yesterday. Oh yeah, it doesn't seem 100% safe. Yeah, it's the Nirvana fallacy. Walking them through it is like pulling teeth. Yes, it is. Correct. So yeah, the requirements for MAID are not only strict, but relatively extensive in what you're required to get. So you need an assessment that takes 90 days, 3 months roughly, by 2 individual practitioners that are not necessarily doing it at the same time. Right? They're not necessarily doing they might overlap, but they're not necessarily. Maybe one doctor is paid $200 million. Or both doctors are paid $200 million. Well, you might notice that in the criterion that we listed, they can't be benefiting directly from your death. That is part of the procedural safeguards. And the independent witnesses and stuff. So there is no monetary incentive for a doctor to provide this. Did I say 2 million? Sorry, 20 million. There's no, like, again, the difference between having universal healthcare versus having, like, I'm not sure something like MAID would function very well in the United States because of private practice. If a doctor is going to directly benefit monetarily from your death, then that's a conflict of interest. By breaking the law, you do. Well, yeah, if you're breaking the law, you're breaking the law, though. That's like saying, well, why do we have any law if people are just gonna break it? Like, yeah, people might break the law, sure. Yeah, that can happen. So, like, somebody could try to use coercive control, and there are safeguards in the way to prevent that from happening. So, yeah, some doctors might try to break the law, but there are safeguards in place to ensure that doesn't happen. Like having 2 to 3 professionals, the board, the criminal code, the needing the consent and needing witnesses, all those things are preventative from something like that happening. Don says, I was talking to one of his doctors. I'm not sure who he is, but that's fine. Oh, Grandpa, sorry. Grandpa has something like this going on as well, but it's dementia. We all encouraged him to take steps towards assisting dying, but he was too scared. He regrets it, though. It's very dark. And what makes people go through at the end of their lives, yeah. What we make people go through at the end of their lives is a disgrace. That's unfortunate. I was talking to one of his doctors about his treatment, and they were saying that certain kinds of treatment are unethical, basically because they don't want to keep him alive for too long, yeah. It's like if you're not allowed to kill him and he's not allowed to die, but it's fine to give him lousy enough treatment so that he'll die on his own. It reminds me of how people step over homeless people on the street because it's not my fault. Yeah, that's a whole thing. There's a whole ethics board around it and like the level of suffering, but talking about ethics is complicated for people. Like, ethics is sticky. Ethics is a sticky and uncomfortable topic, and I would say probably the majority of lay people, like the average person on the street, do not know how to discuss ethics. They might talk about ethics on a semi-regular basis, passively, but they don't really have a solid grasp of ethics, in my opinion. You're playing the librarian cleaning game. Is it fun? Is it good? That was more or less the argument the guy had yesterday. Yeah, more or less. Yeah, more or less. It's like if it's not 100% perfect, then it's not worth doing. So my question to that would be, okay, so do we just let 20,000 people suffer because of a hypothetical someone might slip past the system and do something illegal or unethical to somebody else and then also get past all of the safeguards and also get through right? I was mentioning degenerative neurological conditions. Oh, yeah. That's rough. Ethics equals making some suffering diffuse enough so nobody can be blamed and held accountable for something bad going on so everyone can ignore it and pretend it isn't happening. Nihilistic view, but, not invalid. Ethics is as complicated as philosophy. Well, yeah. I mean, ethics is part of philosophy, and I don't think there's a lot of people with a lot of training or knowledge in philosophy in the first place. So doing something as complicated as ethics is also notably difficult comparatively. Like, you have to have the right sort of mindset from it, because like when you're talking about ethics, you have to talk about like, okay, well, it's a priority conversation a lot of the time. What do you prioritize? And people aren't comfortable with that. You have to prioritize that. Death exists. Bad things exist. Life is shitty sometimes. So you could say, like, listen, ideally, it would be great if we could all just hold hands and sing Kumbaya, and then when our time comes, we just evaporate with no suffering whatsoever. Like, yeah, sure, great, but we don't do that. That's not the world we live in, guys. I'm sorry. Unfortunate, but true. So, if you're not in that mindset, you're not gonna have an easy time having the discussion. You have, like, if you're trying to talk about ethics, you're gonna have to be comfortable with being uncomfortable about what's going on or what you're talking about. Well, the United States is also weird because you can be sued simply for saving someone's life on the street or something. Yeah, there's like some... The United States is a little bit unique in the way a little bit dystopian in the way it handles this kind of stuff. I'm scared of death. Existentialism can be a motherfucker, but you've got to address it. It happens. It exists. You can be in denial. You can pretend it isn't. You can ignore it and hope it goes away. But, like, it's not gonna. Some of the neurological conditions will fully lock people in their bodies with no way of contacting the outside world, and some people have more or less continuous consciousness. Yeah, there's some fucked up things that can happen to people. Things like being trapped in your own body and not being able to move, and like all kind, like it's full even just being paralyzed. Chronic pain is really bad. Chronic pain is a bad one, man. Like, there's a lot of bad shit out there. Like, and it's not even like, I don't want to make it a competition, you know what I mean? But like, dude, shit sucks. Life is hard and shit sucks sometimes. In Germany, you get in trouble for not doing first aid. Yeah, if you're there are certain laws and rules in Canada, like when you get your license to do certain things. There's a reason why Jordan Peterson, like, got his license revoked, right? And then he fled to the United States. Doing CPR can, like, break somebody's ribs. So if you do CPR on somebody and you harm their body when you do it, you could end up, you can end up, like, so they end up with medical bills and then they'll sue you for the medical bills. Elderly care industry is like an enormous racket, and it's going to continue to grow and become more corrupt as the population ages. Where are you? It cost my grandma hundreds of thousands to get someone to come over and shower my grandpa, so it leverages her exhaustion and lack of support to bankrupt her. Yeah, that's not good. Australia. Okay. Thank you very much, but I listen to a podcast. Yeah, I know. That's what it feels like sometimes. It really feels like we're sitting here going through and looking at the actual, like, information. We're looking at the law. We're looking at, like, the assessments and what's required. We're doing as much as we can to be informed about what we're talking about. And then somebody turns around and says, "Oh, but I listened to this podcast one time." And what was it that Joe Rogan said? I listened to a guy on Instagram that said said maple syrup was more healthy than honey. And he sounded really convincing. It's okay, guys. Pierre Poilievre and Joe Rogan told you that you could just lift some weights and you'll be fine. South Korea, Germany, China, a lot of countries will soon be asking these questions far more openly as the populations get both older and less kids and money. Yeah, in Canada, we have a larger population that is older right now, and when COVID happened, so this is a thing. I don't know how much you guys would be aware of this if you're not in Canada. One of the things that happened during COVID is the military was mobilized to help in healthcare facilities, specifically healthcare facilities surrounding elderly care. And the military went there and went, what are the conditions here? What the fuck is going on? And so it looks like there was like a lot of like either misappropriation of funds and abuse and people not getting the care that they were supposed to be getting. And so there was like a whole investigation that went on because of COVID. And because the military were required reporters, right? The military were like, this isn't up to standard, guys. And so there was like a whole thing. I'm not even sure it's all currently resolved right now. So it was a whole thing. Federal care insurance here in Germany, yeah. Rogan using the walk it off approach to mental health care, yeah. Fact. The natural, Don says the natural outcome of that is that my grandma resents your grandpa and wants him to die. Yeah, it's through no fault of his own. It's not even really her fault either. She's just like, she's basically being mentally taxed to the point where what else is she supposed to think? Yeah, do we want to know what happened? Yeah, I'm not sure where that's at. I don't know. What would I need to look up to pull that up? Yeah, and I don't know, like, how much mental fortitude you expect somebody to have at that age. You know what I mean? Like, how, like, it's one thing to, like... It's difficult. It's a complicated... Bipolar depression, yeah. What would I look up? I'm searching, I searched elderly care facilities reported during COVID. So here's Statistics Canada for COVID impacts. Yeah, I might need to, the last 10 years has been, when was this? 2021. Yeah, I'm probably gonna have to go through this on another stream. I might have to do some digging to find out what happened with that. So maybe we don't do that today, and I will try to remember. But I really wanted to like cover MAID a little bit more thoroughly because like as much as the arguments were like just a little bit on their face fallacious, you didn't necessarily need all this information to be able to like argue against what was being posited yesterday, but I thought it would still be like useful information. So if you come across this stuff in the future, you know what the fuck you're talking about, as opposed, and you're gonna, when you know what you're talking about, you're gonna have an easier time recognizing when somebody else doesn't know what the fuck they're talking about. We had this grandpa who was caring for his wife. He essentially brought her to the insurance office to make them pay for the expensive pull-up diapers so he could continue to care for her himself. They ended up paying for the expensive diapers, yeah. Yeah, I don't know. Everything, we need to do better. This is like short answer, we need to do better. The long answer, capitalism is in the way a little bit. Toxic capitalism. I don't think all capitalism is bad. I just think unfettered, unregulated capitalism with no socialism is not a good idea. I don't think... Only Sith deal in absolutes. I'm that kind of person where I'm like, oh, we want a little bit of this here, want a little bit of this there, want a little bit of this over here. Use the good things where they're applicable. But yeah, I don't see how medical assistance in dying would disproportionately affect LGBTQ members. Do you guys think that it would? Do you guys think that the... Again, I certainly don't think they should be excluded from accessing healthcare. I don't think anybody should be excluded from having access to it, but I don't see how the criteria would mean that, like, it doesn't seem to be targeting them as a demographic like somebody was suggesting. Hot take is that if we treat life as way too precious, if we're not equipped to give people a decent quality of life, preserving them to prolong their wretched conditions of life is cursed. Me and you are on the same page. I agree. You think it would be proportional? Yeah, the other problem with this question is we're dealing with like a really small number. The number is like 4.4%. And then it would be like a percentage within that 4.4%. I think it could, but that's a reflection on how society treats them like shit. Yeah, I don't, yeah. I could see it be higher if they did not get denied proper gender affirming care. Well, so the other thing to do with that is, like, again, the difference between Canada and somewhere else. Canada rejected the Cass report. Alberta rejected the Cass report. Like, the most MAGA... The Texas of Canada rejected the Cass report. So, actually, what has happened with the Cass report? I haven't looked that up in ages. Should we see? Where's the Cass report at? From last time I heard, Cass was getting sued. Yeah, PubMed says critically appraising the Cass report, methodology flaws. Right. The Cass report was... Okay, I've got the Wikipedia up. We've covered it a couple of times and we were kind of following it. The independent review of gender identity services for children and young people, commonly referred to the CAS report, is an independent review commissioned in 2020 by NHS England and NHS Improvement and led by Hilary Cass, a retired consultant pediatrician and the former president of the Royal College of Pediatrics and Child Health. It dealt with gender services for children and young people, including transgender youth and those with gender dysphoria in England. The final report was published on the 10th of April 2024. The review made 32 recommendations across all aspects of service provision, which were largely welcomed by UK medical organisations, though some criticised parts of the review. The British Association of Gender Identity Specialists and UK Association of LGBTQ+ doctors and dentists criticised the review. Medical organisations outside of the UK, International Medical Organization, and other countries' clinical practice guidelines have criticised its methodologies, findings, and recommendations. Following high-profile media coverage, Cass expressed concern that misinformation about the review had spread online and elsewhere. The review was endorsed by both Conservative and Labour parties, although LGBT plus Labour criticized it. The Green Party initially supported the review, but pulled their statement following the condemnation from LGBTQ members. LGBTQ advocacy groups in the United Kingdom and internationally have criticized the review. So it is... We looked at it and thought it was bullshit. Manya looked at it from a more professional standpoint as an author, or as a, I guess she is an author. She's written some of her own stuff, but as like somebody more professional than I am, and she assessed it and was like, "This is trash. This is a garbage. Like it has a lot of like issues inside of it." And so where's it at? Where is it at? Number of referrals. A lot of people, a lot of politics utilize the report to justify anti-LGBTQ things. The Labour Health Secretary who accepted its findings recently resigned. Good riddance. It'll be interesting to see how the new person accepts or rejects it. Yeah. The methodology, blah blah blah. Interim report. Yeah, the interim report of the CAS review was published without peer review in March of 2022. It said the rise in referrals had led to staff being overwhelmed and recommended the creation of a network of regional hubs to provide care and support young people. The report said the clinical approach used by the Gender Identity Development Service, or GIDS, quote, had not been subjected to some of the usual control measures and, quote, typically applied with new treatments, blah, 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 blah. The final report of the CAS review was published on the 10th of April 2024, alongside a series of systematic reviews and a survey carried out by the University of York encompassing the patient cohort, service pathways, international guidelines, social transitioning, puberty blockers, hormone treatments, and psychosocial treatments. Findings: lack of research in the field. The report states that the existing evidence for both endorsing puberty blockers and hormone therapy and non-endorsing treatments, psychotherapy interventions in children and adolescents with gender incongruence is weak. Needless to say, people were like, sounds like bullshit. We have shitloads of information about this. Increase in referrals, social transition, puberty blockers, blah, 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 critical pathways guidelines, blah, 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 blah. Here's like the fucking appraisal scores, yada, yada, yada. Conflicting clinical views. The report said there were conflicting critical views among clinicians regarding appropriate treatment. Recommendations, implementation, reception within the United Kingdom, response from the UK political parties and the public bodies. Conservative Prime Minister at the time said that the findings shine a spotlight on the need for cautious approach to child and adolescent gender care. The Labour Shadow Health Secretary at the time welcomed the report and said it was a watershed moment for the NHS's gender identity services. In April 2024, the Green Party and Wales released a statement supporting the review. This was withdrawn an hour later after LGBTQIA+ Greens threatened to support from the party's leaders. Equality and Human Rights Commission and non-departmental public body described the CAS review as a vital milestone and called for service providers to fully implement its recommendations. Response from developed governments. The Scottish government said it would take time to consider the findings of the review. The leader at the time said the review would be given utmost consideration, that all recommendations made by it would be considered, and that the decisions and changes to treatment as a result of the review would be made by clinicians rather than politicians. The Scottish Greens, then a part of the Scottish government, criticized the review at its initial publication. Far too many criticisms for the review for him to say it was a valid scientific document. Welsh initially voted against a motion tabled by the Welsh Conservatives, Shadow Social Justice Minister, to accept the findings of the Cass report in full. Subsequently, it voted unanimously to pass an amended motion. Citing the Cass review finding in August 2024, the Northern Ireland executive agreed to an extension to the ban on the private sale and supply of puberty blockers in Northern Ireland. This was supported by all of the parties. Hilary Cass's response. In an interview given a week after the release of the final report, Cass described receiving abusive emails and said she was given security advice to avoid public transport. She said that, quote, disinformation had frequently been spread online about the report. Cass said deliberate attempts, quote, to undermine a report that has looked at the evidence of children's health care, end quote, were, quote, unforgivable, end quote, and put children at risk. There were widespread misleading claims from critics of the report that it had dismissed 98% of the studies it collected, and the studies which were not double-blind experiments. Cass described these claims as being completely incorrect. Although only 2 of the papers collected were considered to be of high quality, 60% of the papers included were considered to be of moderate quality and were considered in the report's evidence synthesis. Cass criticized Labour MP Don Butler for repeating inaccurate claims that the review had dismissed more than 100 studies during a debate in the House of Commons. After talking with Cass, Butler used a point of order to admit her mistake and correct the record in Parliament, stating the figure came from a briefing she had received from Stonewall. In May of 2024, interview with the New York Times, Hilary Cass said, I quote, I think there is an appreciation that we are not about to close down healthcare for children, but there is fearfulness about healthcare being shut down, and also about the report being weaponized to suggest that trans people don't exist. And that's really disappointing to me that that happens, because that's absolutely not what we're saying. She also said that the review not be about defining what transgender means or rolling back healthcare, stating, quote, there are young people who absolutely benefit from the medical pathway, and we need to make sure that those young people have access under a research protocol because we need to improve the research, but not assume that that's the right pathway for everyone. In May of 2024, an interview with WBUR-FM, Cass responded to WPATH's criticism about prioritizing non-medical care, saying that the review did not take a position about which is best. Cass hoped that, quote, every young person who walks through the door should be included in some kind of proper research protocol. And for those, quote, where there is a clear clinical view, end quote, that the medical pathway is the best, will still receive that. And to be followed up to eliminate the black hole of not knowing what's best, end quote. Responding to claims that the review assumed that trans outcome was the worst outcome for a child, Cass emphasized that the medical pathway with lifetime implications and treatment required caution, but, quote, it's really important to say that a cis outcome and a trans outcome have equal value, end quote. Global reception. Professional organizations and transgender health providers have widely criticized the review's findings. Their current policies supporting such treatments are grounded in evidence and science. Quote, does not contain any new research that would contradict the recommendations made by our clinical practice guidelines or gender-affirming care, end quote, and concludes, quote, banning evidence-based medical care based on misinformation takes away the ability for patients and parents to make informed decisions. That was the one of the societies responding to the report. The World Professional Association for Transgender Health
released an email statement saying the report is, quote, rooted in the false premise that non-medical alternatives to care will result in less adolescent distress, end quote, and further criticized recommendations which, quote, severely restrict access to physical health care and focused almost exclusively on mental health care for a population which the World Health Organization does not regard as inherently mentally ill, end quote. Debate Pub is supposed to be at 5 p.m. Eastern today. An official statement expanded on these concerns, saying Hillary Cass had, quote, negligible prior knowledge or clinical experience, and that, quote, the research and consensus-based evidence, end quote, suggests medical treatments such as puberty blockers and hormone therapy were, quote, helpful and often life-saving, end quote. It questioned the provisions that puberty blockers only in the context of research protocol, quote, the use of a randomized blinded control group which would lead to the highest quality of evidence is ethically not feasible. Yeah, there was a lot of ethical problems. Australia had the Royal Australian and New Zealand College of Psychiatrists rejected calls for an inquiry into trans healthcare following the release of the Cass review, criticizing it as one review among several in the field. They emphasized that, quote, assessment and treatment should be patient-centered, evidence-informed, and responsive to and supportive of the child or young person's need, that the psychiatrists have responsibility to counter stigma and discrimination directed toward the trans and gender diverse people, end quote. A joint statement by Equality Australia, signed by the Australian Professional Association for Trans Health and others, said the review, quote, downplays the risk of denying treatment to young people with gender dysphoria and limits their options by placing restrictions on access to care. New Zealand has a whole fucking thing that they went on. Canada, the Canadian Pediatric Society responded that, quote, current evidence shows puberty blockers to be safe when used appropriately, and they remain an option to be considered within a wider view of the patient's mental and psychosocial health. Members of the Canadian Pediatric Society's Adolescent Healthcare Committee stated, quote, there are significant limitations, biases, and inaccuracies within the review. That the review has been noted to include incorrect citations of evidence and inaccurate, sometimes scientifically disproven speculation. And concluded, the Cass report is a critique authored by a single individual presenting a perspective on current practices in a particular context, and it will inform care. It does not, however, purport to be, quote, the new international standard of care, and it should not be treated as such. So needless to say, Canada was way fucking, like, that's aggressive for Canada. So, like, compared to the way the UK handled it, compared to Australia, New Zealand, compared to the way other people talked about this, that's a straight-up condemnation of the review, and then also a condemnation of the way other countries were handling the review and how they were treating it. Needless to say, Canada is a pro-LGBTQ place and is voted one of the safest places in the world for LGBTQ plus people. And I am very proud of that. That means we need to do better. There's more we can do, but it means trans rights and LGBTQ rights are human rights, and anything else or anything less is unacceptable. Ha 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 ha, get fucked. Everybody else. This is why we have gay hockey propaganda. I'm never gonna get over that. I'm never gonna get over that. Hello and welcome to our pro-LGBTQ plus segment. Germany, Austria, and Switzerland. In 2025, a collaboration of Germany, Austria, and Switzerland, led by the Association of Scientific and Medical Associations of Germany, produced new clinical practice guidelines on transgender healthcare, which criticized Cass's review methodology, conclusions, and lack of transparency. The guidelines stated that there are, quote, no proven effective treatment alternative without body-modifying medical procedures for a person with permanently persisting gender incongruence, end quote, and criticized the potential potentially harmful recommendation of psychotherapy for distress related to gender dysphoria, as no studies in the review showed a reduction in dysphoria through psychotherapy. It further criticized CAS's lack of involvement from medical professional societies, its assurance group, quotes, being explicitly uninvolved in the development of recommendations, and the presence of an advisory board whose composition and contributions weren't documented. Woohoo! So, yeah, Germany, Austria, and Switzerland. It took until 2025, which is a little bit disappointing. Canada, the reason why there's no date on this is because it was at the same time. Like, the review came out, and Canada read it and went, nah, fam, this ain't it. When did it say it was released? Let me double check. I know it was April 2024. So it took like a year. April 2024? Am I right about that? Sorry, I gotta double check my date here. Oh, I gotta way up. Sorry. Social transit. Methodology, background. When was it released? When was the full release? Am I blind? The interim was released in 2022. Final report, here we go. April 2024, yeah, I was right. April of 2024. Let me just scroll on back down here. The UK just needs to grow the fuck up. Yeah, the UK needs to fucking get on their shit. The UK needs to finish going through its Brexit growing pains already. It was released while Steve was actively killing NSS. It was released while Steve was actively fucking the corpse of the Non Sequitur show. Japan. In August of 2024, the Japanese Society of Psychiatry and Neurology published updated guidelines on the treatment of gender dysphoria. The guidelines considered the CAS review describing it as specific to the unique situation in the UK, which is such a good, like, what a way to dismiss it. Noted criticisms of the CAS review by other international organizations and stated that the WPATH SOC8 considered more systematic reviews. The guidelines further stated it is, quote, self-evident, end quote, that unless puberty is suppressed, development of sex characteristics are irreversible in a person who were assigned male at birth. The society stated that they will continue to track and recommend prescriptions of puberty blockers in Japan to minors and expand to tracking discontinuations and switches to hormone therapy. The Netherlands Amsterdam University Medical Center said it agrees with the goals of reducing wait times and improving research, but disagrees that the research base for puberty blockers is insufficient, stating that puberty blockers have been used in trans care for decades. It stated they did not consider it ethical to mandate youth who desire puberty blockers to be registered in research trials. That it was worrying that after closing GIDS, youth seeking trans healthcare were deprived of care, and that it, quote, regrets that this situation arose for patients in England. Bro, globally panned. Every other country is looking at the UK and shaking their finger, being like, what the fuck are you doing? Poland. A Polish framework guidelines for process of caring for the health of adolescent transgender T and non-binary NB people experience gender dysphoria was released in 2024, which said the CAS review, quote, caused a stir in public opinion and immediate harsh criticism from the medical patient communities worldwide, and criticized CAS being chosen for her lack of experience in trans healthcare. It stated, quote, the common thread of many objections to the CAS report is the multifaceted downplaying of the importance of the voices of adolescents and their families, clinical practice, the scientific knowledge base, and national and global recommendations, while misleading the public that a complete lack of clinical experience in a given field is a guarantee of reliability. Holy shit! Poland was like, fuck you, and I'm gonna spit on you. Oh my fucking god. They're absolutely right about puberty. I had to go through the wrong one, and I'm still having issues years later. Yeah, valid, fair. The United States. All right, guys, how do you think the United States did with this? Probably not good. I should probably make this smaller so you guys can see it. United States. The American Academy for Pediatrics responded to the report by reaffirming its support of gender-affirming care for minors and saying that their current policies supporting such treatment are, quote, grounded in evidence and science. The American Psychological Association stated that they were studying the Cass report but stand by their position statement in support of gender-affirming care. In May of 2025, the United States Department of Health and Human Services, under President Donald Trump, released a report on youth gender-affirming care in compliance with a January executive order forbidding the government from supporting gender transitions under 19. The report, which has been criticized for advocating conversion therapy and spreading misinformation about gender-affirming care, the co-author by Zaina Abruzes, I don't know, the co-founder of the anti-trans nonprofit Society for Evidence-Based Gender Medicine, and expressed support for the Cass review and its findings. The report cited it extensively, calling it the, quote, most comprehensive and most influential evaluation of youth gender-affirming care to date. The United States fucking wander... What? I'm not muted, am I? Muted? You guys are crazy. I'm not muted. What are you talking about? Do you guys think that it is authoritarian for a politician with zero expertise in a field to write an executive order enforcing the medical community to ignore and deny something that they have already scientifically assessed and found to be the case? Do you think that's authoritarian? Yes, no. I see chat, but I'm a little bit confused. I'm not sure what we're talking about. You've lost me. You guys have lost me. You guys left me behind while I was reading. How could this happen to me? Yes, you think it's authoritarian? Yes, you think it's authoritarian? I think that's pretty authoritarian. Do you think somebody in a suit without any expertise should be allowed to decide what medical care you get? I don't think so. RFK Jr. had to fucking AI generate his own research with zero citation. Ugh. It feels Nazi-ish. Do I consider Nazis authoritarian? I'm pretty sure that Nazis tend to lean heavily on authoritarian behaviors. I come in peace. Hey, Bongzig. I spent the entire first half of this stream. The first hour of the stream was all going through MAID. So you might wanna roll back or watch the first half later. Are Nazis zero carbon though? Are they carbon neutral? What's the difference between carbon neutral and zero carbon? Yeah. Right now we're looking at the Cass report, or we're sort of looking at 99.99%. Oh, don't be mean. I don't think that's mean. I think that's funny. We're looking at the Cass report because I was curious to see. I know that Hillary Cass was in legal trouble, and I was looking for the update. And then I was looking, and I got squirreled by just looking at what other countries had said about the CAS report. We covered the CAS report before, if you want to go back and check those out. I believe we covered them on Dumbfuck Friday, because that's how bad the CAS report was. Like, the CAS report was so fucking stupid that it was, like, sent to us by some really fucking idiot guy in the UK, who we then fucking criticized, and then we went through the CAS report itself because of how stupid it was. Yeah, by all means, go check it out. We looked at the criteria. We looked at the specific criteria and discussed it a little bit. If you have comments, feel free to let me know after you've watched it. Reception by academics and researchers. I mean, we kind of talked about that before, so I'm going to skip that. Yale Law School Integrity Project. The Integrity Project at Yale, what the fuck is this? Released a paper which said the CAS review had serious flaws. The white paper, co-authored by a group of 8 legal scholars and medical researchers, suggested that the CAS review, quote, levies unsupported assertions about gender identity, gender dysphoria, standard practices, and safety of gender-affirming medical treatments, and it repeats claims that have been disproved by sound evidence, end quote. It concludes that the review is, quote, not an authoritative guideline or standard of care, nor is it an accurate restatement of the available medical evidence on treatment of gender dysphoria. Holy shit. Stupid guy from the UK talking about the CAS report could be a guy named John Hamill, specifically that guy named John Hamill. Fuck that guy in particular. He's an idiot. Specifically. That guy. In particular. And was I not clear? John Hamill. Reception by advocacy organizations. Okay. I mean, I don't know how convincing advocacy organizations and their opinions are going to be to people who are against in the first place, because they're going to see it with an inherent bias. But I think if you're going to do that and be aware of that bias, you need to be aware of that bias from both sides. So, like, if you say that, hey, I'm not going to take seriously what an advocacy group for pro-trans people is saying because they're stating out loud that they're pro-trans, then you also should be equally as critical as an anti-LGBT, or like an anti-trans group. And be like, well, this is an anti-trans advocacy group, and this is a pro-trans advocacy group, so obviously they're going to be saying opposite things. So, and obviously they're going to have a bias towards those things when they present their evidence. However, as long as that bias is up front and you're aware of it, you can take that into consideration when you're reading it, and therefore you should not necessarily dismiss it on a whole. Right? Now, you might have other reasons for dismissing it on a whole, and that's fine, but it should not be because they've stated their bias clearly. And again, if you're going to apply that as a reason to dismiss it, then you need to dismiss both equally, because if you're not dismissing both equally, then you're just being biased to one side. Unless you have other reasons. Why did he start to why did John Hamill decide to go in on me and Manya? Because he's friends with Steve. I was hoping you would say John so I could say it again. John. This is John Hamill. God, that guy's so fucking dumb. And then he got embarrassed by Generic Minority and Manya, and then went crying to Steve. And it was really fucking funny. If you want to go watch it, you can. It's on the YouTube channel. It's in the live streams if you want to go find it. I think we need more studies. It hasn't been around long enough to make an accurate call. What are you talking about? You're saying it. What is the it you're referring to? I swear to God, I'm going to make a whole new show, and it's going to be called Talking in Circles, where I basically just pull up a thing, we have a topic, then people come into the chat, or I give them a number to call in at, and then we sit and I will talk in circles with them for like an hour. About what their issue is. Well, I want to know what the it is they're referring to. More studies on what? Puberty blockers on what? What are you referring to specifically? I'm gonna get more tea. I'm out of citrus. I need more tangerines. There's another John who is friends with Steve and happens to be from the UK. He talked endlessly about the Karen's report. Yeah, there was you're talking about, so there was John Hamill, but you're talking about the John who said that we can't have gender neutral bathrooms in the UK because the plumbing and because the designs of the buildings are too old. That guy? That guy? Is that the guy you're talking about? What a stupid fucking thing to say. Tell you what, I promise that while we're talking in circles, Jester, you won't get timed out. I promise. Nobody will time you out while we're talking in circles. As long as you don't break terms of service. If you violate terms of service, there's nothing I can't help you with that. You're on your own. What a stupid ass fucking thing. Why do I remember that? Why my brain is a fucking goddamn steel trap of bullshit. We only have male or female door signs. We can't put both of them on the door. You can only have one sign on the door at a time. It's illegal to do anything otherwise. That would be funny law. My brain is the misclocker. my brain is the kitchen drawer, the kitchen junk drawer. Thank you for the hammer. I promise that while we're doing discussions like this, you will not get banned and you will not get timed out unless you violate terms of service. If you violate terms of service, you're on your own. Plastic bags, rubber bags, some useful batteries, push pins. Sometimes there's safety pins in there. Usually at least one fucking Sharpie, one permanent marker. Some string, a button, some lint. A tiny pair of scissors. Old manuals to the microwave. Yeah. Batteries that died years ago. The batteries, one of the batteries is still usable, the rest are not. We have transgender bathrooms at my university. They were assigned male at construction. They have top surgery scars where... can we just... Why? Just fucking why? Hamill is one very broken nutter. Yeah, I agree. Hey! Hot take, Carney's true colors were displayed when he became a banker. Should have known he was the enemy based on that alone. Valid. I should probably change the name of this stream though, because we definitely have used this video as a jumping off point, but we have definitely not talked about it at all today. We were looking at the cast review. We were looking at the cast review because I wanted to see where the fuck it was at, because last I heard Hillary Cass was being sued. And so I was looking for that update. And I haven't found it yet. You have to understand that these guys don't understand gender-neutral bathrooms because the one in their home is effectively a men's room. Yeah, that's a good point. Is there anywhere that people have urinals in their own home? I have never seen a urinal in someone's house. They forgot that women study engineering too. No, wait. So you're telling me that they legit built and constructed a building and forgot that women attend the building as well and had no women bathroom in the building? So they had to, like, transition the bathroom into gender-neutral bathrooms? That's fucking funny. That's fucking hilarious. Alright, let's double check Cass and see if there's anything in here. I'm just gonna look on the side. You guys don't have to worry about seeing this. I'm just gonna fucking scroll through this real quick. Oh wow, there's nothing. Wow. Oh! Yeah, of course she's... Of course she's pro the state of Israel. Of course she is. Women are pretty forgettable. What are we, people? Yeah, yo, you right. You get it. There used to be only one women's bathroom. That's crazy. US doctors were out of date on gender care in 2024, she said. Review is expected to begin in November of 2025. I don't have an update. I don't have an update about her getting sued. Maybe I shouldn't look up the Cass report. Maybe I should look up Hillary Cass legal. Sued for withholding Cass review papers. Alright, well, here's one from the BBC. This is from 2024. Hillary Cass weak evidence letting down children over gender care. Josh Perry, LGBT and identity producer. Children have been let down by lack of reasons. Cass review published on Wednesday. Yeah, okay, this isn't what I'm looking for. Hillary Cass sued for withholding Cass review papers. Coalition of trans advocates have sued Dr. Hillary Cass and NHS England for failing to release crucial documents from the 2024 Cass review. Despite being subject to transparency laws, the lawsuit argues that Dr. Hillary Cass and NHS England improperly withheld these internal records. The outcome could significantly impact trans youth access and gender-affirming care and set new standards for public health accountability. This is as of June of 2025. Yeah, here's the lawsuit. Redacted. Freedom of Information Act. My appeal is late because NHS only responded on the 28th day. Oh, yeah, of course, they're playing fucking games. Allowed the appeal substitution and substitute a notice that orders a public authority to disclose. You were listening to Asmongold. No, nobody should listen to Asmongold. Nobody should listen to Asmongold ever. You know, I have a response for anybody listening to Asmongold. Hold on. I got you. Where the fuck is it? Here it is.
Fuck that guy and his fucking YouTube videos. Stop listening to a man who doesn't know what the fuck he's talking about, you idiots!
A legal proceeding has been issued against Information Commissioner, suing Hillary Cass personally. Cass review contains... Yeah, I don't have an update. Yeah, that's the same document. Yeah, I don't have an update on this, so I don't know what's going on yet. Somebody named Hillary hid documents and misled people. I'm shocked. Did Jester answer? I didn't see. Did I miss it? Did Jester answer and I just didn't see the comment? If I missed it, I apologize. Socials are Faculty small enough that they have 2 bathrooms, 1 for women and 1 gender neutral. I wish we had some gender neutral bathrooms in the engineering building. They did do a better job for civil engineers, architects, math, and computer programming. Oh. Listening to Asmongold is better than looking at him, and looking at him is to be infinitely better than smelling him? Why? Why are you putting that in my brain? Why would you speak that into existence? I don't want to think about what Asmongold smells like. Oh, he smells like old Taco Bell cheese. Guaranteed. Like the spicy cheese. You know what I'm talking about. Like the low quality fucking United States Taco Bell too. Our Canadian Taco Bell is better than the American Taco Bell. Because our fucking rules around food and meat specifically are better. Fucking gross. Who smells worse, Asmongold or Jared? Oh. Do we need to make a tier list of like smelly, like how YouTubers smell and Twitch streamers smell? Oh god. Old milk. I mean, cheese is old milk, isn't it? Technically. Alright. I'm gonna go. I didn't cover this video at all. I'm gonna change the name of this video, this stream, because we didn't cover this at all. We didn't cover the video at all. Maybe I'm gonna give up. I might give up on covering the rest of this video, quite frankly. The next thing he's gonna talk about is like the Sovereign Wealth Fund, and then he talks about, what the fuck is this part? Oh, privatization of airports. And then he says something about Mark Carney's perspective. So I don't know. I don't know if I'm gonna finish covering this video. I don't know if I care. I mean, we should go over the Sovereign Wealth Fund. Is probably a good idea to talk about, but maybe we will use a different video. I mean, to be fair, this video has gotten us a lot to talk about because of like discussions in the chat and like what we ended up looking up and stuff. But like, fucking Christ. It looks like he smells like gym socks and vinegar. Jared? Or Asmongold? Jared definitely smells like BO. Minimum. Definitely. Minimum. Yogurt drink left out under the radiator for a week. Ugh. Alright. Fuck this, I'm leaving. I'm getting out of here. You guys are gross. How could you do this to me? How could you bring this up? I'm gonna go take this video and take yesterday's video and I'm gonna chop it up into other smaller videos. You have a list? Get the fuck out of here. You made a list? No, I'm leaving. We're done. I'm gonna be live later. There's a debate about the moon landing coming up with FTFE over on Debate Hub. So if you're interested in informative, useful, and productive debates, go subscribe to Debate Hub. This one might be a dumpster fire. This one might turn into a dumpster fire. I'm not 100% sure. I don't know for sure. We're not trying to build a dumpster fire, but it is a debate about the moon landing. I think this is gonna be a debate where we get opening statements and then it's just gonna turn into discussion because that's just the vibe I got. I don't know for sure though. My bias will likely not be present. Listen, I'm just there to moderate. I'm not there to give my stupid fucking opinion. So we'll see where it goes. We'll see what happens to it. I'm gonna get on out of here. Oh, I saw Jens. Sorry, Jens. I didn't see you pop in. Hello, welcome. Remember, trans rights are human rights. Remember, LGBTQ plus people are in fact people. And don't let people fearmonger you about shit they clearly don't understand. Just because somebody else is afraid of something doesn't mean you need to be. And also, maybe just look it up. Just look it up. And if you want to talk in circles, come hang out with me. I'll do that shit for days. Thank you. Good day. Have a good Saturday, everybody. I will see you guys later on Debate Hub. Please join us. Go subscribe. Consider becoming a member. There's Patreon as well. Thank you. Bye. Bye-bye. Bye-bye. Bye-bye now. Bye-bye. Bye-bye. So long. Goodbye. Bye-bye now. Goodbye. Bye. Bye. Bye.
You don't want to be like this. This is disgusting. This is awful in every way. If I could kill it, I would. But I legally can't. But I've considered it.